Thank you for joining us on another season of Beyond Clean, a live podcast where the cleaning industry talks about everything that is healthy, positive, and proactive. Beyond Clean is a podcast that is broadcast out of our studios inside Gym Supply in Orlando, Florida. We're always looking for guests at Beyond Clean, so reach out to me, your host, David Thompson, at dthompson@academyofcleaning.com or call us at 888-999-6059. Be sure to follow us on Facebook, Twitter, and Instagram. Now, let's get started with today's guest on Beyond Clean. Good morning, everyone. I'm Dave Thompson. I'm the director here at the Academy of Cleaning Excellence and the host of our podcast on Podbean Live, Beyond Clean with Ace. Today, we're not live on Podbean, but you're probably listening to it on the podcast. It's recorded for you, so don't try to join live today because that's not what we're doing. And the reason is, as you probably can see on the screen, I have a guest speaker in the studio. Yes, live and in person. Now, it's a little bit impromptu, so bear with us a little bit. As you can see, Daryl Hicks is here in the classroom. If you've been on one of our podcasts or on one of our classes, you'll know that Darrel Hicks is from St. Louis, Missouri, and he is not there anymore. He is in Orlando, Florida, here in the studio with us. Daryl, let's just do a little mic check and make sure everything's working right.
Good morning, Dave. Glad to be here.
Okay, so for those people that don't know who Daryl Hicks is and why this is such a big deal, let's kind of clue them in because, there might be a lot of listeners that have seen or heard from you, but as we do with all of these social media, there's probably new people. So let's start there, Daryl.
Yeah, thanks, Dave. I began my career in cleaning and disinfecting hospitals back in 1981 and, spent 34 years doing leadership in hospital cleaning. And retired at the end of 2014. So soon to be 7 years on the retirement side of things. But I just always knew that I had too much gas left in the tank to just go and sit and watch daytime television. So instead, I'm here with Dave and glad to be here. And instead of being 1,400 miles between us, there's about 25 feet. And
so we're still practicing social distancing, just not as far.
Well, that's one of the things about, that this past 15 months of COVID has taught us is that it's good to see, real live humans and not Zoom. And, a lot of talk today is people are just Zoom fatigued, and some companies are calling it Zoom free Fridays, so that at least one day out of the work week, they're not having Zoom calls or Zoom presentations or whatever. But I'm glad to be here. And since I've been retired, been doing stuff with Dave. He and I in the last 14, 15 months, I guess we did over 1,000 training education sessions for frontline workers and for the experts in infection prevention control. And the reason I'm so interested in this is that, I wrote a little book called Infection Prevention for Dummies. It was published back in 2010. And it's about the importance of cleaning and disinfection in saving lives. And Dave's own moniker is, I'm a janitor and I save lives. And so he and I have shared this, I guess it's an approach to cleaning is that we don't clean for appearance sakes, we clean for health sakes. And so he and I have been on this track for a while together. And so I'm just glad to be here. But, there's so much to learn about this cleaning and disinfection. This past year has taught us a lot of lessons. And number one lesson was we weren't prepared for the massive efforts in providing safe sanitary surfaces. And in the public.
So now you may have listening to Daryl talk like that we just have known each other here because of the pandemic. That's not true. We've been associated before he retired. So Daryl is a co-author of almost all of our infection prevention courses here at the Academy. Also our certified environmental services technician course. So if you want to get some of that and you want to do the online courses, we have those available. We have the infection prevention technician, which is online, and the expert, which is what Daryl mentioned, is one of our live classes that we do. Matter of fact, we'll be doing a session this afternoon and tomorrow afternoon in conjunction with the recordings we're doing for you today. Daryl, one of the things that we want to talk about during this time together is there's some new things that have happened, and we're launching the master's program for this fall. So whenever you think about what happened over the last 15, 16 months, and I look back at some of the recordings that we've done and the information, things have changed for the industry. The public is much more aware than they've ever been of what we do, but yet I still find that there's a tremendous amount of the people in our industry that's reactionary and not proactively thinking about what do we do after the pandemic is quote unquote deemed over by the professionals.
Well, the fact is, CDC this week came out with a statement that said that, this COVID virus is transmitted by airborne nuclei, and we showed that in our expert class how these things stay in the air. But so I think that the public is still expecting clean, and if things are visibly soiled, then they're not going to believe just because you put a hand sanitizing station by the elevator that the place is clean.
Right. I mean, and this is what you're talking about. There's an acceptance level that has been elevated, a public awareness. And I mean, you see this because, especially early on in the pandemic, if you weren't wearing a mask, people just gave you a really dirty look, and today, of course, we live in Florida here, it hasn't always been quite that way, but today it's more of a choice. And I think as we come out of the pandemic, it will still, as far as masks anyway, it'll be more of a choice. Because I think you've said earlier, we don't yet know how many people will voluntarily wear a mask. And this is going to affect our flu season. I think we had some conversation about that before as well.
Yeah, because of the masking, social distancing in some places in the country, still on, non-essential, lockdown, people on non-essential sort of jobs who can work from a distance are not out there mixing and mingling. But, we have the situation where as more Americans get the vaccine and get immunity from the vaccinations, and we get the herd immunity from people who have been exposed to it, who have natural.
Well, this is it. And I think one of the things that you mentioned, you're kind of on a vacation trip, but not totally, because you're here working with me. But you and your wife got your first vaccinations, you got your second ones, and so now you feel, I guess, free to get on a plane and fly around the country now.
Right, and my wife has some health issues with her cardio system, and she wasn't ready to get on an airplane until she had the vaccine, and it worked out great that we got it. It'll be 3 weeks ago tomorrow, and so CDC says after 2 weeks you're safe to fly wherever you want to go.
Oh, so I'm okay. You're safe now, right? So
Yep.
now that means I can be close to you, even though it's 25 feet right now.
Yeah, one of the things about this vaccine is that once you have it and have it for at least 2 weeks, is that, I cannot get the COVID. If I do, it's there have been some cases where people have, but they were probably infected before they got their vaccine. And I won't go into all that, but it's a very small portion. This vaccine is very effective, and I encourage you. I got it for my wife's sake because I didn't want to bring anything home to her. Dave has some, we do it to protect other people. And now, whenever I do wear a mask, it's because I don't want people to be afraid around me. I not only can't get it, but I can't give it to people. But that doesn't mean that I don't respect people's fears. And I think those same fears get carried into the building. And then, whether it's masks or vaccines, those same fears get carried into the building. And like I said, if it's visibly soiled, carpets, I don't understand these places that have been closed for all these months and then they reopen and they've done nothing to take care of, dirty carpeting and visibly soiled. So like I said, just because you put a hand sanitizing station by the elevators or the time clock doesn't mean that people feel comfortable coming back into that building.
Well, I think this is a thing that we were talking about, a little bit earlier than this time last year when we first started doing our expert live classes back last February. One of the things we talked about at that time, still talking about now, is the flu, the common everyday, and I hate to say common because you make it sound like it's no big deal. 60 to 80,000 people a year die from the flu. And this year we've seen a large, almost non-existent amount of that happen. And we talked last year this time, Daryl, that it was going to be because of masks and social distancing. And I think this is the thing that the experts and you and I being in that group of experts are talking about now. What's going to happen come October through the flu season 21-22 for a number of different reasons. One is, as I think you've mentioned before, we usually build these shots, although we call them a vaccine, these shots, based on what happened the preceding year. And this year we don't have that information.
Yeah, a lot of people don't understand that this vaccine, one of the reasons why it came to the market so quickly was it's not grown in eggs. And that's how the normal vaccine is, the flu shot, I should say. They put these different strains of flu, whether it's influenza A or B, or it'll be one or the other. It's a Hong Kong flu that was back in the 60s and killed hundreds of thousands of people around the world. But there's these flus that have been around for a long, long time, and we still don't have a vaccine. We have a shot that is a cocktail of what they think is going to be. They look at what has happened last year, flu season, and that's what goes into the flu shot this year. And since it was so low, they're worried that there's going to be seasonal flu like we haven't seen before. So I'm just saying that to say that we still don't know, and because these flu strains have to be grown in egg yolks, whereas the one that we're receiving today is RNA. And what you may not understand about RNA starts off in the DNA, goes to RNA, that then goes into protein for our bodies. So it's a one way, and that RNA winds up being a copying machine of the virus. So, wherever they have this replicating, they don't have to grow it in eggs. So it came to market in 7 months, 8 months, which was unheard of. It's almost like putting a man on Mars is what was done in this country in the world last year. And but like I said, it's only a one way, so it doesn't affect your DNA. And I'm getting a lot more technical than I should be, because I'm just this fountain of knowledge, and I just want to share it with you. But
Daryl, I was just thinking, you know, I said something about the flu, and man, we're getting a microbial lesson. But this plays into some of what we're talking about, though. This is knowledge. This is why we have classes here at the Academy, and Daryl's leading me real carefully. Thank you, Daryl. To something that we've put together. It's called the Master's Class for Infection Prevention. And this is about knowledge. What Daryl and I are talking about right now is what the experts are looking at that will not, that there's not any real indicators yet, but we're looking ahead. We're proactively thinking about what we're doing. And the leaders in infection prevention are doing this currently. We're not dealing with today whether you should wear a mask or whether you should social distance. That's all old hat. We already know what to do. What we're talking about here is what's going to happen this time next year. And this is what you and I started doing last year this time with the expert course, is thinking ahead. Yes, you have to work with what you're doing today, but leaders think ahead. We'll talk more about the master program, but to your point of education, this is proactively looking at not just one thing. And so what I'm really concerned about, Daryl, is the CDC coming out this week saying, well, this is all airborne. There's not a real good chance of you catching COVID on a surface. You don't need to disinfect like you were. What I'm afraid of is the public taking that message and going completely back the other way.
Yeah, I don't think that is going to happen, because people have become accustomed to safe surfaces. And I don't care if it's in public transportation. You know, we've seen some weird stuff this last year, Dave, of people out on the streets and machines fogging the streets. And, you know, you cannot disinfect dirt. And but it was a visual for the public to feel safe, you know, safer. And, you know, these drones flying over stadiums and disinfecting seats, it's all just a visual. And we know that, you know, you have to remove the soil and for the disinfectants to be effective. Otherwise, you're just disinfecting soil, and that when that soil comes off, then, you know, the disinfectant's gone too. So people who don't understand that cleaning is both a science and an art, and so they're not accustomed to doing things the right way. And I think in this last year, we here at the Academy have been educating people about the right way to do things. And then when they do the training programs, you know, if they know the why behind of what they're doing, then the how-to will become much more meaningful to the frontline workers. And part of that is just defining what clean is. And so, you know, we have to start with this foundation, and, you know, through the programs that the Academy has for, what is it, Dave, the frontline technician program, and then the expert is building that foundation of knowledge, so that as we go on to the master's program, that people have that foundation so that we can build on it. And so we're looking for people in the master's program who are leaders in the business, and or a wannabe leader who may have 2 years of working experience. They've gone through the previous classes, and now they're ready for the master's program. And so we're building on that foundation that has been laid this last year. And if you haven't taken those courses in order to get the master's, you have to go back and get that foundation, and then you'll be ready for the master's. And it doesn't matter if you're just eager to learn, but what I look at in leaders is that they're not managers. They're, you know, people who manage their operation just go through a formula for that. And we're not looking for people who follow formulas. We're going to help you build a formula for the future. And what we do is we take what we have learned for the last 15 months about this virus, and we're preparing for the next pandemic, and we don't know if that will be this fall or if it'll be a year from now. But there's so many other things that are on these surfaces that that CDC's guidance this week about COVID being mostly transmitted through the air isn't true for a lot of these microorganisms that make people very sick or even die from. And I think we have taken our eye off of those this past year, and I think it's almost to the detriment of our public that we have let off the gas on these other bacteria and viruses and fungi. And now we may have another situation, public health situation, because the CDC has said we don't have to disinfect surfaces for COVID.
So I think this is the thing that we're talking about, Daryl. As experts in the field of infection prevention, we need to be looking for the next pandemic. And I think one of the things that you've brought up, and I've heard others talk about too, is that we've kind of been in a cycle of about every 15 to 20 years that there was a pandemic. Ebola came along in the last 10, and we've had SARS, and we've had MRSA,
swine flu.
We've had all of these. Some of these we have shots for, some we don't. But the one thing that's universal, and I always say this is the first step of infection prevention, is cleaning. And this is a big thing that we focus on. Now, that's what we can manage. We're doing it today. We manage that. So folks, don't get us wrong. We need strong managers that are managing current everyday programs. That's why we have the technician and the expert. The master that Daryl mentioned is going to be a completely unique, offering to the industry. We're putting together something that you've never seen before in our industry. And this is a 4-day live interactive town hall type session with 4 industry experts. I'll get into that a little bit later. But Daryl, why are we putting together a program that's like this and not just doing another Zoom class or another webinar like you and I? And I'm not putting anything down with those, because you and I attend them, we conduct them, people learn from them. But why move it to this master with this live interactive town hall type program?
Well, Dave, we have 3 of these masters programs scheduled for this fall, but between now and the first one, and between the first one and the second one, there's new information that comes out, and we want these to be dynamic in that they will take what is happening in the world currently today, and that it's like writing a book and then getting it bound. And Dave and I have a problem with, I've got this little book that was, published back in 2010, the Infection Prevention for Dummies book. And, the next year is obsolete, because once you print it and put it into a book, it's no longer dynamic. And so we make these things so that it is current and up to date. And, in this master's class, that it's going to be interactive, and, it will be a discussion, a conversation. And so it's different than this one-way learning that people are accustomed to. I took one of these online courses from a big, you would know the company, a chemical disinfectant company in this country, but it was recorded probably 2 or 3 months ago, and it was about infection control and prevention. And I wound up with more questions at the end of it. It was things that they said that just didn't jive with what Dave and I talk about, and that it's cleaning is so essential. And I think that we think because we got this one step cleaner disinfectant that we don't need to clean anything anymore. And I'm of the mindset that we need to remove the soil, and when we remove the soil, with the soil goes the bad guys. So if we can remove the soil at 99.9% with the right microfiber denier cloth and a general purpose cleaner, Dave and I talk about, one of the things that no one talks about is rinsing surfaces, and that we wind up with this biofilm that winds up on surfaces. So I'm not going to go into all that right now, but the point is that there's a lot to learn, and you may have to unlearn some of the things that you believe to be true. But that's what this master's course is to elevate your understanding of the problems that we face in the general public today and the public safety. And so it's taking what has happened with COVID and some of these other things that are happening, and I guarantee you that it will be up to the minute information that you will be getting if you attend one of these master's courses this fall.
So let me give you kind of a little bit of an outline, folks. Daryl kind of hit the nail on the head. We do not want you to attend a session with us in the master's program and wind up going, okay, so now what do I do? This is the biggest dynamic part of this. During those 4 days, you are going to be able to access one-on-one or in a group conversations with industry experts. I'll outline the 4 experts here in just a moment. But the way we're putting this together for you folks is what we want you to do is start thinking now of real life situations that are challenging, or ones that you see as a leader that are going to be challenging you in the future. Don't hold anything back. Throw everything at us. Daryl's got a little thing about stump the band, and I'll let him talk to you about that here in a minute. But the whole thing here is we want you to send to us before the sessions your questions, so that we'll kind of start these with a kind of a town hall thing. We're going to take your question, we'll throw it to the panel. The panel discuss that, and you'll get an answer from the panel about their viewpoint. And I'm sure that some of that will be a little bit of controversial discussion, as these things usually do. Because not everybody agrees with everybody on everything, which is why Daryl didn't quite agree with everything on that course. Now, nothing wrong with that. Matter of fact, that's the way we learn. Now, the next part of this is we want you to also come to the session and actually talk with everybody, not just the expert, but with everybody worldwide that's on the call, and present what is happening to you today, the challenge that you're having. We don't want this to be fictitious, pie in the sky type stuff. We want this to be current right now, because we're right now recording this for you here in the first week of April. By October, things are going to be different. They have been all year. So in a little bit, I'll talk to you about who's going to be on the panel and everything. But Daryl, what's this stump the band thing?
Yeah, it goes back to the old Johnny Carson late night talk shows. And Dave said, you're dating yourself. And I say, yeah, those were the good old days. But he would always do this thing called Stump the Band, where he would send someone with a microphone out into the audience, and someone in the audience would come up with a tune that Doc Severinsen and the band had to know and to play. And so, if they stumped the band, then they got a bigger prize. So anyway, there won't be any prizes.
I was going to say, I hadn't heard about the prizes. Now you got me going, Daryl.
Yeah. Maybe if you stump the band, I'll send you one of my books. But anyway, I think that, the concept is that, I guarantee you that if you don't get an answer from one of the panelists, there's probably someone in your work group here online that has face that same similar situation, and they can talk about what they did to remedy it. So, that's the synergism that we're looking for. It's not just a one-way lecture, and Dave won't allow that to happen. It's going to be interactive, and if we have 15 people on the call and they're from 15 different places, then we'll get different perspectives from people. But just because you're in schools and someone else that is in long-term care, will be on the same call, it doesn't mean that we can't learn from each other. And that's one of the things, we are a small subset of all the population of workers out there, in that we are left with the charge to protect the public's health. And Dave talks about that people have this heartburn about calling us janitors, but whenever you look at the origin of that term, it's got a deep history, but it was the keeper of the keys, and they were in charge of the public's safety and protection.
Well, my moniker that I have, folks don't know if you've seen it or not, is I am a janitor and I save lives. And I think that's the root of everything that I do here at the Academy. We have a very noble profession. And this master's session, and I say class, it's actually sessions, is going to elevate that. And I think this is what you've seen, Daryl, over the last year.
Yes.
The public awareness of our industry and our importance in what we do has been elevated to an all-time high for us. On the other hand, whenever you say, like the thing is, don't disinfect as much from the CDC, people have a tendency to swing completely the other way. So as we work through this year of 2021, I think things are going to have another face. They had a new face last year. I think it's going to change again this year. So when we get to the Masters this fall, the situation will be different. Now, one of the things that I want to let you know is Darrel Hicks, that you see here on the show with me today, is going to be one of our experts. And as Daryl said, he comes from the healthcare industry as a leader there. He's been the past president of IEHA and also another institute. I forget what the name of it was.
Yeah, it was the Healthcare Surfaces Institute, and it's a not-for-profit organization, but we look at the role that surface composition plays in the transmission of disease. And this Formica tabletop is different than the stainless steel on the or the chrome on the bathroom fixtures. And so pathogens hide in different surfaces, and it's different if it's brand new than if it's 20 years old. And I always feel like it's not the employee's fault that they use bowl cleaner on the faucet handles, and now the chrome is gone and they're green and green corrosion all around. That's not the employee's fault. That's their leadership's fault. And some leader let them do that. And so I don't blame the frontline workers. I blame us for not educating people. But what I'm saying is that, we have to look at those surfaces and their composition, but it's going to be much harder to disinfect that corroded faucet handles in the bathroom now that the chrome plating is gone. So we're not just looking at new surfaces, but over time, if you look at these surfaces under a microscope, you see pits and valleys and deep scratches and places for pathogens to hide. And so it's going to be harder to clean and disinfect that surface over time. And, so our institute is just looking at all that hard and hard and soft surfaces and the ability to keep the public safe. And one of the things that we find out, and Dave and I have talked about this, is, carpets, being a soft surface, is that As I like to say, it's like a unicorn. The idea that we even sanitize carpets is a unicorn, and doesn't exist. It's a myth.
So the one thing that you see, folks, is that when it comes to practical skills and managing and then leading a department for healthcare issues and situations, Darrel's going to be one of our panelists. We're also going to have Dr. Greg Whiteley, which is going to be on the panel from Australia. He is, well, I would say a chemistry guru. He works on the chemistry side of it there in Australia, works with the CDC, works with a number of other different bodies that are actually helping with some of the mandates that you've actually seen come out this last year. But one of the reasons that he's going to be on is to talk with you about chemistry. But one of the big things that he, Darrel, and I all agree on is measuring outcomes. And he's very big on, it's not just the chemistry you use. And Darrel and I talk about the process, but he's very interested in how can I verify that the product, the process, and our technique actually got us the result. Because as you just heard Darrel say, just because it says sanitizer on the label doesn't mean I can sanitize carpet. How do I measure the result of what I've done? So Dr. Greg Whiteley is going to be on the panel for that. We also have Dr. Aaron Bushko from Bradley University, who's going to be on the panel to talk about business and business management and development and marketing, what you're doing. Because whether you're an in-house service provider or you're a building service contractor, no matter where in the world you are, whatever you're doing today and what you're going to be doing in the future as a result of this masterclass needs to be marketed. Not just to your technicians, as Darrel said, to make sure that they're doing the right thing, but that the public is aware, that the establishment is aware. Because what we have learned over this last year, this isn't one person's job. It isn't one entity's job. It's all of our job. And so he's going to be on the panel to talk about marketing and business strategy. He's wrote several books, just the same as Dr. Whiteley has. And then, Darrel, you have a good relationship with another person, but he's a microbiologist.
Yeah, he's the germ guy, and his name is Dr. Rodney Rohde, and he's down at Texas State University, and he teaches microbiology to nursing and medical students, and even the lab techs that actually do the bench work. And he's very knowledgeable, not just about microbiology, but he gets what we do. He is a big cheerleader for us in the cleaning and disinfection business. And he understands our struggles, but maybe he'll help you understand. And what I told Dave earlier is, whenever you go into a restroom, public restroom, I always said you need a microbiologist's vision of what the pathogens are in that restroom and where they're hiding, and why that's important. So Dr. Rohde will educate us about all that stuff about the bacteria, viruses, and fungi that exist very happily in those restrooms. And what Dave and I were talking about earlier is restroom odors. And whenever you approach a restroom in a restaurant, and 10 feet before you get to the door, you smell the air deodorizer, the cherry flavor, cherry bomb, you know that the place is not clean, because they're using deodorizers to cover up the odors associated with urine and with bacteria that has just decayed in there from years of not getting removed. And so, we're not into covering things up. We're into removing them, and then you get this microbiologist view. But odor control has a lot to do with removing the soil, removing the bacteria, and don't leave anything behind for that bacteria to feed on. So Dr. Rohde will bring a lot to the conversation, and if you ever wanted to talk to a microbiologist, this is your opportunity. This is heaven to me, is to be able to talk to the germ guys.
So folks, as you can see, what we're going to have is we have a very robust panel. This is going to be very dynamic in the fact that nobody's doing this. If you look around, matter of fact, we challenge you right here live on camera today. If you've seen a program like this, or if you know one, please tell us, because we haven't found it, and that's why we've put this together, this panel for you. As we said, think about what's going on. You now know an outline of the 4 people that are going to be on there. Somebody said, well, there's 5. It's going to be you, Dave. Well, yeah, I'm going to be there, but I know it's probably hard to imagine. I'm going to try not to talk a lot. Yeah, well, I've got a moniker that people say Mr. Talks a lot. So, hey, what can I say? We are all here for you to learn. This is what we want. If you're a leader, if you're trying to move forward, I don't care if you've been in the industry 2 months or 25 years, it doesn't matter. Come to us, go to www.academyofcleaning.com. You'll find out all about the master's program. Now, as Daryl said, you have to go through the technician and the expert so that you're up to speed with where we're at. We don't want to rehash that. That's not what the master's class is for. The master class is so that you can bring your real life issues, situations, challenges to a group of experts. And by the end of it, you're the only one that's going to say, I didn't ask enough questions, not us, because that's what we're going to be here for. So you'll see all the schedule of when they're going to be coming out and the prices that are associated with it. And if you've got a suggestion, send it to us. So think about your questions. Send those to us now. Sign up, get registered. It is worldwide because it is going to be on Zoom. It is going to be virtual. There'll be different times because it's not going to be at the same time every day. So please join us for that. Daryl, I think one of the things that we also talk about when we talk about infection prevention is change.
What I say about change is that, you can either change or you can be part of the change. And, you don't want to be part of the change. You want to change your methods, your way of communicating things, but you have to have a foundation of knowledge. And that's what this academy was built around, is increasing knowledge. And what is it, Dave, that you say, what are the foundations for the knowledge that
Well, as you can see right here behind me on my screen, knowledge protecting health. That's on our shield. This is what we believe. We're talking about infection prevention. It couldn't be any more accurate. If you don't have the right knowledge, you can't protect health. Now, it doesn't mean that you're not doing something right. Everybody's doing something right, but that's what the master program is about. And this is what we found the academy on. It's gaining knowledge. And this isn't rehashing what you've already been doing. We're not here to teach you what you already know. We're here to change your mindset. And yes, that's challenging. It's controversial. And you know what? I had a class here yesterday. Yes, we do have live classes, by the way. He was here in person, and I thank him for that. But during that class, he said, I'm going to have to buy something different. That what I've got isn't going to work. I said, why did you come to class if what you wanted to do was the same thing with what you've already got? That's not the reason you come to an academy class, Daryl.
Right. The old adage that, what is it?
Daryl, I'll tell you what, that jet lag must have got to you coming down here. He flew down here from St. Louis yesterday, and now I mean, I'm one with you, but I can't read everything that's in that head over there.
I knew if you talked long enough, David, it would come back to me. The definition of insanity is doing the same things the same way and expecting different results. And we cannot be operating the way that we did even a year ago. into the today and into the future. So, you have to come with the mindset that, you will have to change some things in your operation. And that means that we have educated you and given you knowledge that you didn't have, or connected some of those dots so that you get a complete picture. But, it will be dynamic, and you will undoubtedly want to change things. Not that it will be dictate from us, but from your fellow classmates and from the experts, you're going to hear things that you had not thought of. And if that happens, then it's going to change you, and hopefully for the better, because ultimately we're about the public's health and safety. And so,
Daryl, if you haven't been challenged, if you don't change, you haven't learned.
Exactly.
You haven't moved forward, and that's what it is. We have a podcast, and you may be listening to the podcast version of this recording today. And on the podcast, there's 3 words: healthy, positive, and proactive. That's what we want to talk about. Controversy always comes up, but this isn't about all the negative stuff. This is how to move forward, because in infection prevention, I'm not here to deal with what's already happening. That's what we manage. This expert course that we've had is how to manage current situations, and we have to have that. Matter of fact, we're going to be doing a session this afternoon. But the master's course is about, what do I do about things that haven't come up? How do I look into the future? How do I deal with other things so that when they do arrive, I'm ready? And that's where we got caught flat-footed as an industry in 2020.
Well said, Dave. And I think that what we have said is that, we need to educate people on that front line, their leaders, because, we can't wait until the next pandemic is at our doors in order to educate people. We need to do that today to be prepared. It's a be ready and not get ready. And this, at the beginning of this COVID this year, it was getting ready, and people weren't already ready. And so we have to be ready for the next one. And so it's all important to get the knowledge needed to be that leader, the one that others are looking up to for the next one, and looking for your direction and your communication of what do we do, boss? And so hopefully you will be more prepared for the next one than you were for this one. But that's the knowledge that we all need to share.
So I want to thank all of those people, the thousands of people that came through the infection prevention courses last year, either through the online or the live remote expert class. Go to www.academyofcleaning.com. Yes, things have changed. If you haven't been there in the last month, you haven't seen the new change, because we have a new catalog on the front page. Easier to find the courses, easier to find the information. Like we said, change is what we're all about. You can also find us on our podcast. That is Beyond Clean with Ace, all one word, on Podbean. You can find us on Twitter, on Facebook, on LinkedIn, and hundreds of YouTube videos out there. Matter of fact, next week I'm going to be cutting some new ones on luxury vinyl floor care, something that the industry is now fighting. What do we do with luxury vinyl floors? So see, we don't just talk about infection prevention only, Daryl. We got all kinds of things we do here at the Academy.
Well, it is a business, and there are different segments of the business. And, what we're about here at the Academy is equipping you with the knowledge needed for all those different aspects of the business. And, I think that one of my bosses one time, we were doing our annual performance review, and he said until he got that job, he didn't know everything that our department did. And he said, you make it look too easy. He said, you need to communicate to other people about what those challenges are, and that, I think that one of our challenges is that we make it look too easy, and it shouldn't be that difficult, but just to put all those pieces together so that we have a complete puzzle, complete, no missing pieces, and that includes education. And so that's what we're about, is educating you so that as a leader that you are equipped to lead others, that will provide this safe, clean, disinfected environment for staff and for the building, or the people coming into your building.
Daryl, thanks for coming down all the way from St. Louis to be live in the studio with me. I'm going to keep you here for another day and a half so we can get some more stuff in. Folks, we've talked all of this to death. You know what to do. Join us this fall. Join us now. Get with the program. It's about time. Thanks for being here with us and listening to us today. We'll put in the show notes how you can get hold of Daryl and myself, the link to the master's course and everything. So you'll find us. I'm sure that this will be on YouTube later today. It'll be out on the podcast sometime here later as well. Folks, thanks for joining us, and we'll look forward to seeing you again. Whatever you do between now and the time we talk to you next, make sure that it is healthy, positive, and proactive. Thanks, folks.
So long, Dave.